please.
Okay, so
Dr. Suraj, he needs no introduction. Members is a role model for especially me and many others, especially in from BMC. And he's a congenital champion, born genius and champion, and always a topper, always multiple gold medalists in MBBS. He was my immediate senior in BMC, and I know him very closely, and I had a close association with him. And RGHS gold medalist in MS General Surgery with woofing 69% in MS, and also now currently urology resident in INU, BMCRI, and he's a national level chess player as well. That's genius. Even Satvik is also a better player than him, who is his younger brother. So he's the best person. I think when I requested him, I thought Suraj is the best person to take this session, how to face and succeed in examination. This will help most of our members, okay, not just studying, how to really prepare for exam, and what are the practical obstacles, how to face them. Everything need to be, you are really the best person to explain them. So over to you, Dr. Suraj.
thank you, Kishan. Thank you so much for the wonderful introduction. Actually, you have a little bit exaggerated about me. I'm really privileged to give a talk, and you're doing a wonderful job. I thank Dr. Kishan and the entire White Army team. They're doing really a wonderful job, which is beneficial for all the students, the UG students. So they're utilizing their time to the maximum in this lockdown period. So, okay, I think most of them are already logged in right now. So, good evening, my dear students. So, today I'll be speaking about this topic, how to face and succeed in examination. You all would have listened to so many lectures regarding your subject topics and your different various theory topics. So, this is something which is out of the box, and which is actually crucial. Many people used to ask me every now and then, like, what are the things which we need to keep in mind whenever we are preparing for our examination. So today I'll just brief you about some tips and suggestions which will be helpful for your examination. So initially I'll tell you a few things about your theory examination, but today mainly my talk will be regarding in detail about the practical examination. Okay. So I would like to start my talk by quoting these few beautiful lines. This was told to me by one of my most favorite teachers, Dr. Apur Mehra sir. I think most of you know him. He's an orthopedic surgeon, and he conducts this Ortho Dhoom Dadaka class, and it's a very popular class. He motivates the students so nicely, and is an inspiration to so many students, including myself. So these were the lines which he used to tell in his class. Teri kismat da likha, tere to koi kho nahi sakta. It means that whatever is there in the fate, the God has already written your fate, and whatever is there, you are destined to get it. Nobody can snatch it away from you. But still, you need to work hard. You need to work hard. Why? Because the amount of hard work which you put in, whenever God sees that He will rewrite your destiny. Because of the amount of hard work which you put, He'll rewrite your destiny to get something which is better than what you actually deserve. Okay, so that is the reason why you need to work hard, even if you are bound to get what is there in your fate. Okay? And these are some lines which you must always keep in mind if you want to come up in life. Always, first and foremost, respect your teachers. They shape you into what you become, and they build a strong foundation in you. Even if you become very much successful later in life, never forget them. Whenever you meet them, greet them, and then speak to them. Never ever forget your teachers. And next, respect your parents, no matter what. Because in the end, it is your family which will be your strong support for whatever you do or wherever you go in your life. So always respect your parents and your family and all the elders. And also develop contacts in your circles and have some strong bonded friends. Because if at all you want to come up in life, you need to go along with everyone. You can't go alone and succeed alone in your life. You have to have connections with everybody, and you should have a strong friendship group. So now coming to our today's topic. So first I would like to give you some few tips regarding your theory examination. Then we'll go into detail about the practical exam. So first of all, I would like to always start preparing well in advance. So your people will usually have exams in December. So never think that, okay, still you have a long time to go. Let us start much later. Still many months are there, because by the time you realize, time flies very fast. Okay, so always start your preparation well in advance. You'll have time, buffering time for revising also and studying certain other extra aspects. And it's always beneficial if you start well in advance and prepare a timetable. Not everybody has the same pace or can study the same thing in the same amount of time. Each one is different. So according to your capacity, you yourself know what is best for you and what is your capacity. So prepare a timetable and always try to stick to it as much as possible. So whatever you decide, like for today, if you want to study so many chapters, try as much as to finish it in time. Never keep on postponing your things. And perseverance is the most important thing. So for example, I've seen some students, you study for 12 hours, 14 hours one day. Next day, you're very tired. You study only for 2-3 hours and then sleep. And again, the next day you feel you study for a long time. So instead of that, have a regular fixed schedule, and that perseverance is very important. Each and every day, you must stick to that much amount of hard work which you have to put in. And one more important point is audit your day-to-day activity, study activity. Okay. So for example, if you have thought you was finished 3 chapters today, at the end of the day, whatever you have read, you yourself, you are the best person to audit your day-to-day study. So whether you have done it, or if you're not able to do, what is the reason for you not being able to do this? So whatever is the negative factor, you yourself can correct it in the best possible way. And whenever you prepare a plan for the day, it should be done the night before that day. If you think that, okay, the day you'll start, then you'll start thinking what you have to prepare for that day, you're already too late. So on the previous day, before you go to sleep, the next day, whatever you plan to study, make a note of it, just a brief note of it. And then so that the next day when you get up, you're already ready in your mind to study for what is required for that day. And this sort of short-term planning, that will definitely help you in reaping the long-term benefits. No doubt, you must have a long-term goal and you must know in these many months, I need to study so much like that. But your day-to-day audit and your weekly planning, that helps a lot in preparing for your exam. And one more very important question, which a lot of students ask me is, okay, for a particular subject, there are so many books, 2-3 books are available. So if I read only from one book, is it sufficient? Or buying another book, is it a waste actually? But what I would tell you is no knowledge is a waste. Okay. Whatever topics are given nicely in one particular book, you can definitely go through that book and read from another book also. Whatever knowledge you gain is never a waste. It will never go a waste. You never know where that will come in handy and where it will help you. So always try to acquire as much knowledge as possible from as many books. There is never a dearth for knowledge. And now coming to just the day before the exam, many people, what they do is they try to be awake the whole night, try to study, try to revise again and again as much as possible, and sacrificing their sleep. But I'll tell you that is definitely not a good idea. Have a good sleep the night before the exam. So in this way, your mind is also fresh. You'll have a clear thought process in your exam, and you can answer your exam in a cool state of mind. Never be tensed. And you, while answering the examination, always attempt all the questions. Never leave any question. Even if you don't know anything about a particular question, at least answer some points which are relevant to it, or which you know, which are not exactly pertaining to the question, but still some way connected to the question. Okay, you may end up getting 1 mark or 2 marks for that question, no doubt. But who knows, that 1 or 2 marks might save you and become crucial in the end. So that's very important. And all the discussions, readings, notes, and the clinics which you have, everything is important. You might feel someday you're just sitting, chatting with your friend, and then discussing some points. That might be crucial to you in the examination. So never think that, okay, this is not important. Only whatever I sit and study before the exam, only that is important, like that. Each and everything, whenever you're taking notes during your clinics or during your classroom teaching, or some small study materials which you stick to your notebooks, everything is important. You never know when these things come in handy, and these are crucial in those 1 or 2 marks, few marks, which will either sail you from being pass to fail, fail to pass, or getting just few ranks in the top. Okay. And when you're answering the questions in the exam, always think from the examiner's point of view. whenever you are answering, think, okay, if I am the examiner and I am correcting this answer, what I will expect. So keeping that in mind, if you answer, you know very well where and how you should answer. So that will help you fetch better marks. And the presentation, it is the most important thing. Many times what happens, many students, they write the same number of points or the same content, but one gets very good marks, other gets just average marks. The main difference is the presentation. How you present your answer in the exam is very, very important. So you must always, each examiner, nobody will read each and every word of what you have written. The examiner always search for some keywords or the subheadings, and then the key points which you have written in the answer, and then evaluates your answer. Nobody will go through each and every word whatever is you have written and evaluate. So keep that in mind, that the presentation is the most important thing. So next, coming to your practical examination. Today, I'll be discussing a few things about more about the practical exam. So first of all, you must keep these things in mind. For the MBBS practical examination, what are the things which the examiner will expect from you? First thing, history taking. History taking obviously is very important. You must have taken a detailed history of all the presenting illness to all the negative. Each and every negative history is very important, and you must be able to substantiate each negative history why you have asked that question. So whenever you are presenting your case, each point which you say in your case presentation is very important. And obviously, our White Army team is doing a very good job. We are having a lot of this clinics exposure. So that will help you in gaining confidence. Next thing is examination. So the method of examination is most important. So the examiner, he'll ask you, how do you do the particular test? Or what is the method of examination? So for the UG level, so each and every step of method of examination is very important. And what they expect you is you must be knowing the basics and how you reach to that particular diagnosis. So that is what they try to assess. So after you finish your case, they'll go through the basic investigation plan. So you must be knowing what are the different investigations which are required for that particular case, and also about the different methods of treatment which are available. Even if you don't know the details of each and every investigation or each and every treatment modalities in detail, it's not important. It's not, they're not going to ask you so much in depth, but you need to know the different modalities which are present. So few additional aspects about for the PG examination. So for PGs, details of each and every, along with all the points which I've told you in the previous slide, each and every investigation, the complete details, the complete procedure is very important. And how you prepare the patient for OT also is important. And the steps of each surgery pertaining to that particular case, that is important. And also, obviously, the latest advances, you must be well versed. They might ask you about all the latest advances. And basically, for the PG exam, what they expect from you is the patient safe with you? Whenever a patient comes to you, you should be in a position to handle it safely. You should not cause any harm to the patient. So coming to certain important points. See, basically, there is no replacement for theoretical knowledge. You must be completely thorough in your theory knowledge. Even in your practical exam, whatever is pertaining to that case, the theory, you must be totally thorough with it. And some people, they ask, okay, so medicine is so vast, surgery is also so vast. I don't know where to start and how to start. First of all, you can start by reading on a case-to-case basis. Every day study is very important. So whichever cases are admitted in the ward, you can, whenever you go to your clinics, you can see those cases, and pertaining to those cases, you can read that in your textbook. So that is the best way to begin with. And very important, attend your wards regularly. You may say, okay, the consultants are very busy in my unit. The PGs are always tired. They don't teach us anything. But why should I attend wards each and every day? Only whenever required, I'll attend. But that's not important. Whenever you go to the wards, you'll be able to see all the patients. You yourself examine as many patients, as many cases as possible. Apply your theory knowledge to examine the cases. And Sir William Osler, he has said, the wards are the best libraries and patients are the best teachers. So this cannot be replaced by only reading from textbooks. And as I previously also emphasized, just overnight reading, that is not sufficient. It's not important also. Whatever you have read throughout the year, that is more important. Always have a proper sleep, and this will give you a sound mindset in the exam. That is more important. And you will be very fresh to answer the questions which are coming, which are asked by the examiner. And before the exam, never go to the exam directly. Always have a proper breakfast, because hypoglycemia, that blunts your thinking. And when you are presenting yourself to the practical exam, make sure that you have a proper attire, you are well groomed, combed your hair well, shaved properly, and then you should have a proper conduct. Always wish the examiners whenever you meet them. Have a pleasant face. Never be too much tensed, or never always turn your face away from the examiner. Always face them, have a pleasant face. And what is most important is your presentation skills. It's not the English which is important. How you present, how confidently you present, and how fluent you are in presenting. That is the most important, and this has an impact on the outcome. And always remember, the moment you enter the exam hall, the scanner and meter is on. Every action, what you do is being watched, and every word uttered is being assessed. You may think, okay, you're examining the patient, the examiner is sitting on the chair, speaking to his other co-examiners, so he is not seeing what you're doing. Each and every step, whatever you're examining the patient, everything is important. If you do some blunders while examining the patient, even that will be taken into account for assessing your final marks. And each word which you retract, it's also assessed and marked. You should never say, oh, sorry, sir, not this. Every time you utter sorry, that will also have a negative impact on your marks. So ideally, they say sorry score should ideally be 0. It should be as minimum as possible. Cannot be practically 0. And never make some loose statements while presenting the case. Each and every sentence which you tell should be weighed. So never make any statement which you not intend to speak. Only whichever you are completely sure and firm, only those statements you make in the examination. And there is nothing like fun or informal talk with the examiner. The examiner can make jokes, he can laugh, but you are supposed to be formal. On the day of the exam, the examiner, you have to treat him like God. You need to be formal with him. You can't start making jokes with the examiner. So in terms of cricket, if you want to tell the runs you score and the wickets you lose, for everything, either you say or you do. And also which you don't say and which you don't do. Okay, everything is important. And this one, history, most important. You start with your history, so that will create history. If your history taking is very good, if it impresses the examiner very much, you are well through it. Okay, and even your examination, the findings which you do in your examination, that will decide your fate, whether you pass or fail. So always be very careful, be extra cautious whenever you're taking the history and examination. And it's okay, many times you need to cross check it once again. Be very careful when you're presenting. And many times it happens in the exam. So the examiner is not listening to you, he's speaking to someone else, or he's not concentrating. But still, you must present it in such a way that he is fully attentive with you. And the case presentation should be like a story, and it should go on smoothly. And after you finish presenting, you should point to a possible diagnosis. So by the end of history, the examiner should have a probable diagnosis in the mind. And by the end of the examination, either a definitive diagnosis or a differential diagnosis should come in mind. And in between, whenever interrupted, always you focus and answer to the point. There's no need to hurry up or give an answer instantaneously. You can take a few seconds of your time, but always answer to the point, because never beat around the bush. No examiner likes beating around the bush. And avoid any unnecessary confrontations. Many times what happens, the examiner may say a point which you would have read it the day before, and you know that that point might not be correct, but still you must never have any confrontations with the examiner. On the day of the exam, the examiner is God. Whatever he says, you should just say yes and continue, proceed further. Don't start arguing with the examination. And important point, never start show off. You might know many recent advances, etc., but don't show off in front of the examiner. Answer all the basics and whatever is asked, and that is the most important. And logical conclusions, they are the key to your practical exam. And whenever the examiner asks you, only then you explain the logic. Otherwise, it's not required. Just proceed further. And many a times, whenever you are losing track during your case presentation, the examiners try to provide subtle hints, and you must be sharp enough to pick up those hints and tell it in front of the examiner. So what happens is, even when the examiner is providing you hints, many students are so tense that they're not able to pick up those hints and answer properly. And always stay focused and give crisp answers. So don't just give a long, lengthy, irrelevant answers. Nobody likes that in the exam. And analytical, common sense approach to problem solving is the most important, which is needed. And obviously, correct diagnosis is the last requirement. Whenever you're presenting a case, you should know how logically you can explain the symptoms and you can explain the signs which you examine to come to a diagnosis. The correct diagnosis can be something different. After investigation, he might be having a different diagnosis. But if you're logically correct, then don't worry. Never try to first find out the diagnosis and then back calculate. So it will blind your thinking and you'll be biased during your history taking. And this will always affect your final presentation. So always go logically, take history honestly and examine, and then come to a conclusion. So face the problem head on. So let your mind work. It will work even when the examiner questions you in the viva. And next thing to remember, okay, case presentation is over. Next, when you come to the investigations, all investigations, they are not done for fun. So whenever you do an investigation, do it only if it changes the course of the treatment. And whenever the examiner asks you, how do you investigate this case, start with the investigation of choice or the gold standard. That is the important. Obviously, in the book, you will find so many historical investigations which are not at all done nowadays. And don't start listing all of them one by one. Always the most important thing to be told first. And next thing, there are two factors in your exam. One is factor H, that is hard work, that constitutes 90%, and factor G, that is God's blessings, that constitutes about 10%. So if you don't put in this 90% of your hard work, then the 10% of God's blessings won't be sufficient for you to pass in the examination. So the secret to getting ahead is, first thing is getting started. So any work, once it starts, the flow goes on. If you don't start at all, then you will be much behind, lagging behind in the race. So what you can do always in the beginning, start preparing for the common cases. You know, there are so many common cases for each subject. So start preparing for those common cases and do it well in advance. And whatever you people are doing now it's very good and it's very much beneficial for your final examination. So you can do this for all the subjects, but for surgery, I've just shown you an example how you can do it. You can first list the common cases. Obviously, you'll be having long case and a short case. So the most commonly kept long cases are thyroid, breast, abdominal mass, PVD, varicose vein and hernia. And the short cases are ulcer and swellings like lipoma, sebaceous cyst, dermoid, or you can get a hydrocele. So like this, first list out the common cases and start studying each case one by one till you finish all of them. And you can do this for all the subjects. And what you need to concentrate when you're taking the case in the examination. For example, in the long case, a detailed history is mandatory. A detailed examination has to be done. And very important, any other unrelated or unassociated pathology, if found, it must be mentioned. For example, I'll give you an example. One of the students, he was taking a case of varicose vein. And then he has done everything. He has done all the tests, everything perfect. But he has missed out that the patient also has an associated umbilical hernia. And the examiner has examined this patient in detail. Examiner knows that the patient has umbilical hernia. So he kept on asking, okay, what else does the patient have? What else? And this poor chap, he's telling all about varicose veins. He tells about even the venous ulcer, which is present, everything. And finally, even again, the examiner asking, okay, what else? Does the patient have anything else? So if you never miss out such important findings, obviously for UGs, that won't cost you your examination. But for PGs, definitely, yeah, if at all you miss such a finding, that will definitely cost you your exam. So any other associated pathology, if the patient is having, that must be examined and that must be mentioned. It need not be connected to your case, but still it's very important to while you present the case. And all possible investigations you should know, and all the different modalities of treatment you should know. So these are for long case, whereas there are so many differences when you're presenting a short case. Only the positive history is important, and only the specific examination, whichever you need to do, or the local examination is important. And diagnosis should be to the point, and possible cause, if any. For example, if it's an ulcer, what is the cause of an ulcer, like that. And investigations also to the point, which are the most important. And coming to the treatment, it can go anywhere. And case presentation, it is nothing but a storytelling. Now you people have this very good opportunity. Each day one person is presenting the case, so you all have this practice of case presentation each and every day. Sometimes, okay, some people, they might not get an opportunity to present. What they can do, they can catch hold of some family member or some friend and then start presenting to them. And as you can see in this picture, even if no one is available, okay, catch hold of some pet dog and start telling the story. So case presentation is nothing like a storytelling that gives you your confidence, it boosts your confidence, and it gives you the fluency when you present in a final examination. And some of the tricks which will help you after your case present. For example, your case presentation is done. The afternoon session will be your different stations, and your case presentation, okay, it has not gone that well. It has gone on an average thing. So if at all you do very well in your other things, that will push you from being failed to being passed. So always never neglect the other things also. For example, okay, you might be having these instruments. Many times what happens, there are a lot of students taking the exam each day. So the examiner might ask you, okay, pick up an instrument. So what you can do beforehand itself, select a few commonly used instruments. Be well versed with each and every thing of those few instruments, some 3-4 instruments which you have selected previously. So in case during the exam, the examiner asks you, okay, fine, pick up an instrument and tell about that. So you can always tell very confidently and in detail, and the examiner also will be impressed with that. Same thing holds good for specimens. Beforehand itself, you'll be knowing about all the specimens which you'll get in your exam. So best thing is select a few, 2-3 of them, and then be very much well versed. So obviously you must read everything, but this is just in case if you get the examiner asks you, okay, pick any and tell any one of these. So you can always choose the one which you have already well versed. And even if you are asked to speak about any topic, so you can always be well versed with 1 or 2 topics which you can speak fluently and continuously for about 5 to 10 minutes. And on the day of the exam, if such a thing comes, you will be already ready with that. And that same thing holds good for surgeries. Commonly asked is appendicectomy or cholecystectomy. So some of the commonly asked surgeries you can always read thoroughly, so that in the examination these points will give you bonus marks. So that will help you from coming third or second to coming first, or from just being failed to just passed. So these are the crucial areas where these things will come in handy. And coming to the examiners, there are different types of examiners. So you must be intelligent enough to know what type of examiner he is and how you must answer to that particular examiner. Some are old-fashioned examiners, and they expect you to answer the classical findings, the age-old tests, and which are given from long time back. And you must answer to them in such a way that you should not quote about any recent advances or the latest some modification or some controversial issues. They might not like such. Whereas there are some other examiners who have just passed out, and then they might be an assistant professor in some college, and they would have come as your examiner. So for them, obviously, they expect certain latest advances or certain latest additions in the textbooks which are given. So depending on that, you need to answer very cleverly in your examination. That will fetch you more marks. Some examiners, they are highly knowledgeable. They know each and every line of the textbook. For example, some of the examiners, they might be knowing each and every line given in Bailey and Love. So for that, you should never bluff in the examination. Whenever you say something, the examiner is definitely much more experienced and knowledgeable than you. If he asks, you should never say, yes, I'm quoting from this book, when you are sure that you have not read that book. So if you have done a mistake, just accept it and then proceed further. Never bluff. Bluffing in the examination will cost you dearly. And some examiners have a lot of experience, so they'll ask you more of practical questions. So you must be able to answer to them in that aspect. And obviously, some are just seasoned examiners. They'll come each and every exam and they ask the most commonly asked questions. Whereas some others, they might ask some out of the box questions or some very rarely asked questions. So basically, what you need to know is what type of examiner, how you must present to each one of them. And the last point, all of you are already well versed. Some are lenient and some are strict, and you'll always be praying to God that you will go to the lenient examiner when you're presenting your viva, and you already are well versed with the last point given here. Some of the pitfalls what can happen in the surgical practical exam. I just want to give you a few of my. I just want to narrate a few of my anecdotes and tell you where people made blunders and that cost them their exam. So one of my friends had got this carcinoma of the breast case. So his exam was on the third day, and on the first and second day, everyone had presented as a 6 centimeter lump in the breast. So obviously, he also presented as a and he has measured it and presented as a 6 centimeter lump in the breast. But then the examiner went and examined, and he told it is a 4 centimeter mass. So a 6 centimeter lump and a 4 centimeter lump, there is a lot of difference in the case of a CA breast. The entire staging, management, everything will change. So making such crucial mistakes will cost you your examination. And one of my other friends, he had got a case of hernia, wherein the examiner asked him, how will you examine the urethra in case of a hernia? And here, what I would like to stress is when you use the terminologies, each medical terminology is very important. You can't just randomly use whatever gives similar meanings. So he told that yeah, the correct answer would have been to lift the scrotum and examine the urethra. But he mentioned that it is examined in the erect posture. But then the examiner went on to ask what is the physiology of erection, and the viva turned out in a different direction. So whenever you are using your terminologies, be very careful in using them, and always respect your teachers no matter what. Because on the day of your exam, your examiner is God. So never try to tell anything against them, or try to raise a controversy. If at all you feel some point is not in favor of what the examiner is doing, just tell yes, sir, and proceed. Because experience matters. Even though you would have read the textbooks the day before the exam, your examiners would have a lot of practical experience before coming to your exam. And obviously, satisfying all the examiners, it is not easy. So as you can see in this picture, what people think success looks like and what it actually looks like is entirely different. So many times some examiners will not agree to what you're telling, but somehow you need to balance your presentation in such a way that at least you must satisfy the examiners to finally succeed in your examination. So anyone, even the expert in anything, he was always once a beginner. And there are obviously some good examiners in the exam, and out of the lot, you must identify them. And whenever you are presenting, try to look at them and pick up the subtle hints which they are providing. They will help you out. Never just put your head down and keep on presenting without looking at the examiners. So sometimes examiners, they can be ignorant in certain rare cases. So don't worry, never try to teach them. No examiner will like that, a student teaching them during the exam. So it's okay. Always, whatever is most common, you tell that. Any other thing, if the examiner asks you in particular, then you mention it. Otherwise, just leave it. So what I'm trying to tell you is, I'm not telling you it's going to be easy, but I'm just telling you it's going to be worth it. And don't worry about the examiners. So do your best. That's the best you can do. Okay. So always prepare well in advance, and this will help you gain your confidence. So whenever you go to the exam, go with full confidence and present confidently. And whenever let it be any exam, always you give your best. Don't worry about the result. So there's a saying, success does not lie in results, but in the efforts. So being the best is not important. Doing the best is all that matters. So even in Bhagavad Gita, there is a saying, Karmanye vadikaraste ma phaleshu kadachana. It means you give all your maximum efforts and do your best. Leave the rest to God. Don't worry about the result. God will take care. And okay, finally, even the exam is done, but God forbid, for whatever reasons, there is a failure. Never worry. Okay, you can always recover. Failure is never the end, as long as it is not accepted as an end by you. So what seems to be the end may actually be a new beginning. So it does not matter how deep you fall. What matters is how high you bounce back. So let me give you an example. There was one of my friends who was highly intelligent. He used to answer each and everything, even in the clinics, even in the exam. He used to know each and everything in the textbook, highly knowledgeable. But then due to some unfortunate reasons, one more thing I want to tell you, whenever you are, you should have a very good opinion. Your teacher should have a very good opinion about you. Never allow any of your teachers to develop a grudge against you. Okay, so that will if at all any professor or any teacher develops a grudge due to whatever reasons, because of your disobedience or because of your answering back or whatever reasons, you'll never be able to come back in your practical exam. No matter how you answer, he knows how to catch hold of you and make you fail. So I was telling you about this one of my friends. He was highly intelligent, but because of some reasons, he failed in the exam. But it's okay. He never took it as a downfall. During the 6 months which he had to again retake the exam, he prepared very well. And then not only for this practical and theory exam, also for the next NEET exam, and next whenever he wrote this theory exam, he passed it with very good marks, as well as got the first rank in the next qualifying examination as well. So main thing is, if at all any failure is there, never consider as the end or never go into depression. Always try to bounce back. Never mind, you can always come back. 6 months doesn't matter, but later you can always succeed in your life. So what matters is not the size of the dog in the fight, but the size of the fight in the dog. So always try to put in all your efforts, and try to put in all your efforts and do the best possible in your exam. So best wishes to all of you. So may all of you have plenty of factor H and factor G, which I've told you. Have a successful career, and keep this in mind. Practice like you have never won. Perform like you have never lost. Keep this thing whenever you enter your practical exam. So you will come out with flying colors. Thank you so much. So, Kishan, are you there?
Yeah, Suraj. Yeah, I'm very much there. Please
Yes.
stress on the about revision. Like
Yes,
they
yes,
all read a lot. I agree. They read regularly. But what is really missing is repeated revisions.
Yes,
Okay, so
very
please
good point
tell
told
the
by you.
importance of revision.
Yes,
Yeah.
yes. See,
Tell them the importance of revision.
revision
And another
is
point,
very.
I would like to. One more thing I want to ask you specifically. There are two schools of thoughts. One, like you told, for intelligence like you, that's okay. Reading as many books as possible, grab how much of knowledge as possible. That's one part. The other part, for an average student like me, who cannot
You
remember
are
everything.
a topper, Kishan. Come on, you are rank 1 student.
Okay. So what I feel is better to stick on to one book and read it thoroughly and repeatedly, so that I will have a better photocopy memory. Because photocopy memory also important. On the day of exam, you should remember where, okay, if you read, or else what happens if you read multiple books on the previous day of the exam, when you really want to revise something, you can't read so many books.
Actually, that point I wanted to stress. Yes.
How could it be tackled better? Please explain.
Yes.
Benefit of all.
See, revision is a very, very important point, as Kishan pointed out. So for the theory exam, as you said, keep one book, read it thoroughly, revise it again and again, and then that photographic memory will definitely help you get very good marks in the theory exam. But what I stressed reading about different books was in the practical exam. So what matters is not the points, or not the way how you tell each and every point in the practical exam, how much of different knowledge you have in the practical exam. In the Viva, the examiner can ask in any aspect he can go. So in that time, obviously you can't revise the whole thing just before the exam. So whenever you have a lot of time, for example, if the exam is in December and you're still in April, so you still have a lot of time. So whichever topics which are given nicely in each particular book, obviously there'll be seniors to guide you, telling, okay, in this particular book, these chapters are given very nicely, like that. So those things you can read and then make notes and keep it, so that those points which are not given in the particular book which you'll be reading for exam, so that will be helpful for you to finally write the exam. And as you very well said, for the theory exam, keep one book, and then that book you read it thoroughly again and again, and then as many times as possible, revise and revise. That will help you. And this is the main point which distinguishes a person who comes first and a person who comes fifth or sixth. There is no difference in knowledge between the person who comes in the top 10 ranks. The only difference is the person who has come first, he would have revised it again and again and again, whereas the person who has come fifth or sixth would have revised only once or twice. So that is very important. But for the practical exam, it is always advisable, okay, read one book, but also try to acquire knowledge from certain different books, because some points are not given in the other books, and if you are able to answer those points, you will definitely have an edge over the others in the practical exam.
Yeah, what I would like to add is you can read multiple books, but keep one book at and that
Yes,
whatever additional points given in other books, make it a notes in the same one book.
yes,
Okay, they
yes,
add.
yes,
How about that, Suraj?
yes, yes. Perfect. That is perfect. You can
So at
make
the end of the
notes.
day,
Yeah.
the previous day of the examination, you should have only one book to revise. In that, all the additional points, everything should be written in your own like
Correct,
notes.
correct, correct. Perfectly said. So what you can do is you can keep that one book along with all the notes which you have acquired the knowledge from the various other books. But relying on only one book and studying only one book for the exam, you might not gain
Yeah.
the complete knowledge to come in the top. You might be able to pass the exam comfortably, but not come in the top. To come in the top, you must know at least some things from even the other books also. So you can, as you can said, you can make notes and keep the notes and study only those notes along with the one book for the exam.
Suraj, you have so many doubts in the chat section. Please go through
Yes,
them.
yes,
Please
yes.
answer them.
Yeah. So shall I come from the top?
Yeah, yeah, yeah.
Okay, okay.
Is it compulsory to read Harrison to crack NEET, sir? Jay Hanuman is asking.
Yeah, yeah. See, as far as I mean, different people will have different opinions, but my opinion is reading Harrison from the first to last. It's not. It need not be necessary for cracking NEET. You must have read Harrison once, but also along with that, in the way there are so many other books, MCQ books, which are there. So they concentrate only on the most important points which are taken for the MCQs, and for the NEET exam, reading those books and whichever doubtful are there, only those things referring to Harrison is sufficient. Reading word to word and then by hearting Harrison from the beginning till the end, I don't think that is required.
It's after all a reference book. Am I right, Suraj? It's a reference book,
Yes,
so it should
yes,
be kept
yes,
for
yes.
only for important topics and the concepts which we don't understand in other books.
Correct, correct, exactly.
Next
It is a
question
reference
is
book. And then one thing what you can do is whenever there are controversial questions, like one book has given one answer, another book has given another answer. So when there are controversial questions, for those referring to Harrison and then whatever is given in Harrison, you can accept that as the correct answer.
next question is how important is understanding the concept to learn? How understanding a concept, how important it is?
Very, very,
Suraj.
very important. Always
Somebody is asking.
any subject, any topic for that matter, if at all you understand the concept well, then you can answer it even blind, even in your sleep. If somebody wakes you up and asks you that question, you can answer it very well. So instead of by hearting, always the best thing is understand the concept thoroughly. Then you read, and if some small facts are there which have to be by hearted, you can't help. Those things have to be by hearted. You can use some mnemonics or anything else to by heart that. But rest of the things, understanding the concept is definitely beneficial, and you have to do that for all the topics. Okay,
How
next
to write
question.
time management about how to write answers aptly and still save time.
Is it for this one, the theory exam you're telling, right?
Yeah.
Yeah. So what you can do is the total time duration. You can divide that into the number of questions. So, for example,
Exactly.
if each question in the PG exam, you'll be knowing very well the total time duration. If you divide it by 10 questions, you'll get about 15 to 20 minutes for each question. So in such a situation, what you can do is when you're having 15 to 20 minutes for each question, try to answer each question in that 15-minute time slot itself until and unless the answer is really very big and you have to sacrifice another few minutes for that question. But it should never be too long. Maximum of 5 minutes of buffering time you can keep. So if you stick to that time limit, by the end of the time, 15 minutes if you allot for each question, by the time you finish the 10 questions, you will be in the 2.5 hours. You'll have half an hour time buffering time. Even if you have utilized some 5-10 minutes for in between questions, you'll still have another 15-20 minutes time for revision. And this revision is very important. You can underline the important, highlight the important points, as well as add any points or make some changes if you have made a silly mistake in the revision time.
What I feel is that the important keywords should be written first.
Yes.
Because examiners will be looking for those keywords only.
Definitely.
So we should never miss those keywords. So first
and
write them off first,
or underlined,
and then the sentence
appropriate.
can be framed. And next question is, sir, how to make if you're not getting interest in one subject, how to make it more interesting and learn?
Yeah, in this, what you can do is, for example, if you're not finding one subject interesting, in the usually you'll have multiple subjects. You can, in that time, read other subjects and then make in between those subjects. You can put in this subject, so that you won't have it won't be monotonous for you. And one more thing, what you can do, you can study little bit of theory, little bit of MCQs, little bit of some other, you can watch some lectures, and you can, in that way, you can make it more interesting so that it won't be monotonous just by reading the same boring thing. So you, basic thing to make it not boring is to mix it up. You mix up another subject and then along with that you read, so that that will compensate for the time which you feel bored in this subject.
And to answer Shubha Rao's question, to which are the best books, we have already posted many times in our WhatsApp groups, which are the standard books for all the subjects, UG subjects, also for MCQs. We have posted today. Again, we'll post in the groups. Please check about all the subjects. And next question: how to manage sleep during before exam?
Yeah, actually, I wanted to stress upon this point. Sleep is very, very important, not only for having a fresh mindset while studying, and also for you to remember whatever you have studied. So what I would like to suggest is at least minimum of 6 hours per day sleep is 100% essential. Don't compromise for less than 6 hours of sleep. So I'll just give you an example how I used to make the time, but it can be changed according to your sleep schedule or whichever you feel comfortable. So I used to keep it like every day 12 to 6, I will definitely sleep. After 12, whatever it is, I will sleep, and before 6, I won't get up. So the 12 to 6 hours of solid sleep every day I used to ensure. And only during the rest of the time, 18 hours, which we used to get, excluding all the time for lunch, dinner, everything else, the rest of the time you can utilize it for studies. So I feel this would be ideal. What are your opinion, Kishan?
Same.
Yeah.
Most of things, yeah. You are one of your best friends. Dr. Govind Soman is asking, when do we start studying, focusing for final exam for surgery PG? That you have already answered, I think, as early as possible. Please, can you please?
Yeah, as early as possible. And for the PG exam, I would tell you that.
Suraj, listen. One is, what month do we start preparing for the final exam? You want you have to mention the month. Which month is?
Yeah. See, ideally, if you want an ideal situation, okay, obviously everyone knows first year of PG life is very hectic. You won't be having any time for studying. Whatever possible, if possible, study a little bit, whatever possible in first year. But second year is the most ideal time to start studying. Second year, you'll have a peripheral postings, lot of free time. So that is the best time to start studying for your PG exam. So during your peripheries, whatever peripheries you are being posted to, such related topics you can study. For example, if you are posted in urology, read about urology. If you are posted in some plastic surgery, read about those related topics. And finally, when you start final year, that is a must and should. Beginning of final year, you have to start studying. If you don't start studying in the beginning of final year, then you will end up lagging behind. You can never compensate that back. So, and one more thing, study for theory and practical exams side by side. Never think, okay, practical I'll study later and keep postponing till the end.
What I feel is in first year's PG should mainly focus on this clinical examination and how to prepare the patients for operation and operative steps of all the operations they should be doing, because they'll be mainly assisting.
You won't work in the wards.
Ward work,
everything.
Important.
Yeah.
Second year, like you told, they can start preparing for the theory as well as for MCH preparation. Can be second year is the best time if you're really interested in doing MCH. That's the best time. And third year, initially you can spend for thesis work, initial 6 months or so, and last final 6 months you can spend thoroughly for the final exam preparation.
Yes.
And last few 2-3 minutes.
Yeah, next question.
And in my college, clinical teaching is not very nice. Any suggestion to make the best use out of it?
This question, it has a best answer here. Every day, kindly join White Army clinics, and that will be the best thing which is possible right now. They're doing a wonderful job. So you can attend every day. They're having the clinics session and other teaching sessions in the evenings. So you can see this. You will get a lot of interest and be motivated for you to study in the exam.
And which is better, MD-MS or DNB?
Right now, both have equal value. The DNB is nothing inferior to MDMS, but age-old concept is that, okay, MDMS is superior to DNB, and even now some people might say, okay, they might prefer MDMS over DNB, but practically speaking, both are equal. But the only difference, what I would like to tell you here is DNB, in many institutes, what happens is the amount of chances which you get they are very less compared to MDMS.
Exactly.
So in MDMS, you get
Exactly.
a large quantity of chances which will help you gain confidence
Exposure.
and become well versed. Otherwise, the value is same. Both have same value.
And does taking non-clinical subjects in PG is a bad thing? Because everyone says her do clinical. Is it so, Suraj?
No, not at all. Not at all. Many people, they
Yeah.
also prefer the non-clinical subjects when they don't want to have any emergencies, or when they don't want night duties, or when they want to have a calm, peaceful life. They take these first year, second year subjects.
What I feel is every subject has got its own merits and
Yes,
advantages, and
definitely.
it all depends on you. It's not depends on the
Personal
branch.
preference.
It
Nothing is
depends on
inferior,
you.
nothing is superior.
Yeah. If you are really passionate about subject, you can do wonders in whichever branch you take. So it's not the branch that matters, but your interest or the passion in that. Okay.
Correct.
When I have seen after taking anatomy also, they have become very achieved a lot, even after taking anatomy or pharmacology also. So that depends on you entirely, not on the subject.
Yes.
So last two questions.
Yeah.
Can you tell them how to we all know how the memory works, how the temporary memory gets converted to permanent memory and all. So can you please give tips on how to revise, when to revise, or which is the best way to revise?
Yeah, actually, there are different methods of revision. Like different people follow different methods. I'll tell you what I feel, in my opinion, what you can do. So whenever you are reading, like how I used to do, I'll tell you. I used to give one reading completely from the first to the last, and then during my second revision, what I used to do, I used to make points. Each and every topic, I used to make points in that. For example, it might be a 10-mark question, or it might be a 5-mark question asked on that particular topic. So I should just make some points, on 10-15 points regarding that, so that when I'm revising, I can revise those points very well. And during the subsequent revisions, if I don't get time to read the whole book again, just revising the notes is sufficient enough. So during the first reading, why I used to read it fully was that I used to gain the confidence that the entire subject I've read it once, and then along with that, I'll know where exactly what is given in which part of the book nicely. So when I'm reading for the second time, I know exactly, okay, this point is given nicely in this particular chapter. So I can go to that directly and then make notes. So second time I used to make notes for each and every topic and study. And during the subsequent revisions, study either the entire text if it is very important, or if it is not so important, only the notes is sufficient. Any additions to this, Kishan?
What I feel is addition is we should have an additional session for this, Suraj, not just additional point. This session is getting a lot of importance and a lot of demand is there. So soon, within a week or so, we'll have another session about this.
Sure.
We'll have a exclusively doubt clearance session. Okay, all the doubts or clarification.
Actually, I'm seeing in the chat section there are a lot of other questions. So
But I have screened almost many are similar ones. So anyway, we'll have a combined session another day for especially for PGs as well. Okay, how to prepare for MCH and things, how to prepare for exams. So today at 6 o'clock, our professors also waiting. We'll have a case discussion. Okay, today about pneumonia. Mr. Darshan is presenting the case. Pneumonia is a very important book, medicine as well as pediatrics. So let us join for that session. And thank you once again, Suraj.
Thank you so much, Kishan. Yeah, thanks a lot for giving me this wonderful opportunity. I hope it was useful to all the students who attended this session. So you can do one thing, whatever questions you have, you can either send it to me or Kishan, and we'll be able to answer that. And as Kishan said, we can keep one more session only for question answers. So all the question answers, we can have a separate session for that. So I would be very glad to answer the questions, whatever I know from whatever best knowledge I have.
And someone asked for a White Army group link, Gagan, I think. I have posted in the chat section. Through that link, you can join the White Army. What all the books need to be studied, everything will be posted regularly in the groups. And for a quiz also, quiz is coming up, national level online UG and PG quiz. You can join being a White Army member, group member. And once again, thank you, Suraj. Thank you so much.
Thank you so much. Thanks a lot.
You have been a constant source of guidance and motivation. And please continue to do so.
Definitely. Thank you so much.
Yeah. And I'll let you know soon when will be the next session. Okay.
Sure. Thank you.
When are you free? Please let me know. What's your
Definitely.
convenient time? Okay.
Definitely. Thank you.
Thank you, Suraj. Thank you. And
Thank
please about the PVD session also. PVD session
Yes, yes. I will get back to you regarding that. Yeah.
by Dr. Muralidhar.
Yeah.
Thank you.
Thank you so much. Yeah. Thanks a lot.